Education is not the learning of facts, but it is training of the mind to think. And yes, that is what all your exams are now focusing on because we are dealing with the most precious, and that is human lives. So it is very, very important to get your concepts right. Details matter. Yes, they matter. So it is worth spending time to get it right. So that once your concepts are clear, no matter from where they are, from right, left, top, down, everything will be crystal clear to you and you will be able to answer anything, not only answer in your exams. This is going to stay with you for your life. So that is what we are aiming at, to get your concepts clear so that it helps you throughout your life. So with that, we start with the basics of the year. And this is an overview of the year that we are going to have in this module. Where the year is present, what are the structures around it. And yes, this is a very, very, very important module. This will help you to understand a lot about the year. You will be able to answer many MCQs if you have got this straight, if you have got this correct. So yes, I have all your attention now. Whenever you are doing anything, yes, do it with proper concentration. Make your mind like a laser so that whatever you're doing is perfect. So with that, we start with the basics of the year. So the year consists of three parts. We have the external year, medial to which we have the middle year, medial to which we have the inner year. We already know that, yes. Now the external year again consists of three parts. We have the pinna, medial to which is the external auditory canal, medial to which is the tympanic membrane. Medial to that is the middle ear, and yes, we know what do we have in the middle ear? Yes, very good. We have the ossicles, yes, 3 in number. And do we have a connection between the middle ear and the pharynx? Yes, we have a connection. Can you tell me the name? Yes, that is the eustachian tube. So why at all do we have this connection between the middle ear and the pharynx? This eustachian tube, what at all is it doing? Connecting the middle ear and pharynx? Yes, it is responsible for ventilation of the middle ear. Whenever we breathe, the air through the eustachian tube enters the middle ear and ventilates the middle ear. Why at all is ventilation required? Yes, in the middle ear, we have ossicles. And what do the ossicles do? They collect the sound from the external ear and they send it to the inner ear. So they have to properly vibrate to do this. So for proper vibration, we need to have air in the middle ear, and that is done by the eustachian tube. So what if the eustachian tube gets blocked? Yes, if it gets blocked, ventilation will not happen. Air will not enter into the middle ear. So what will happen? The middle ear pressure of air will become negative. So the pressure in the external auditory canal will become more than the middle ear. It will push the tympanic membrane inside, or we can say that the tympanic membrane has got retracted inside. That will restrict the mobility of the ossicular chain, and will that cause a decrease of hearing? Yes. So whenever there is any patient who has come to us with decreased hearing, immediately the complete picture of the ear has to come to our mind, and we need to localize where the defect is, whether it is the external ear, whether it is the middle ear, whether it is the inner ear. So when there is a patient who has come to us with decreased hearing, how can we know that this decreased hearing is because of eustachian tube blockade? Yes, what the eustachian tube does is, because of ventilation, the middle ear pressure is maintained as the same as the ambient pressure outside, same as the pressure of the external auditory canal, same as the pressure of the air pressure in the pharynx. So if the middle ear pressure is less than the outside pressure, in any patient who has come to us with decreased hearing, we know where is the problem. The problem is in the eustachian tube. And also what we know is that eustachian tube is not only responsible for ventilation, it is also responsible for drainage of secretions from the middle ear. So again, what will happen if drainage will not occur? Yes, fluid will collect in the middle ear, and that will again lead to decrease of hearing. And this collection of fluid in the middle ear is what we call as serous otitis media, collection of serous fluid in the middle ear. Now, a very, very important clinical thing that we need to know that happens because of this connection between the middle ear and pharynx is that not only it will bring air from the pharynx into the middle ear, any infection from the pharynx also through this tube can go into the middle ear, which means that any pharyngitis, if you have any throat pain, if you have any infection of the pharynx, if you have any infection of the nose which goes back to the eustachian tube area, then this infection through the eustachian tube can travel into the middle ear and lead to acute infection of the middle ear, and that is what we call as acute otitis media. And all these we are going to do in great detail. Now we are just seeing what these connections are so that we can have an overview of what the ear is all about. Now just medial to the middle ear, we have the inner ear. And the inner ear is also known as labyrinth. The inner ear is also known as labyrinth. And the inner ear, the labyrinth, is divided into two parts. It is a membranous, a sac-like structure, something like a balloon. A membranous balloon. Yes, that is what is known as membranous labyrinth. Surrounding that is the bone, which is known as bony labyrinth. Okay, so before we proceed, let us quickly write this down. So we have the external ear. In the external ear, we have the pinna. We have the external auditory canal. And we have the tympanic membrane. Medial to the external ear is the middle ear. And in the middle ear, we have the very important connection to the pharynx. Yes, and what is the function of this connection? This is what is known as eustachian tube. What is the significance? This is for ventilation and it is also for drainage. Now medial to the middle ear is what is known as inner ear, and inner ear is also known as labyrinth. So till here, we already know that we have the external ear, medial to which we have middle ear, medial to which we have inner ear. What lies just medial to that? Yes, which means if there is a sound, it is picked up by the external ear, it then goes to the middle ear and then goes to the inner ear. Where next does the sound go? Yes, in the inner ear, we have the nerves which carry this sound, these sounds to the brain. Yes, so medial to the inner ear is the brain, it is the cranium. And separating the inner ear from the brain is the base of skull. And on this part of the base of skull is the connection, an opening which connects the inner ear to the brain. So anything that has to pass from the inner ear to the brain or from the brain to the inner ear will pass through this opening, this connection between the inner ear and the brain. And this opening is what is known as inner ear opening or internal acoustic meatus. Yes, so as we are seeing here, this here is the base of skull, on which is the opening. This opening is the internal acoustic meatus. Here we have the base of skull in front of us. Can you tell me where is the internal acoustic meatus here? Yes, we can see so many openings here in the base of skull. Okay, now see very carefully. Okay, now this bone is what is known as the petrous part of the temporal bone, or it is also known as petrous pyramid. Why it is known as pyramid? Because it is like shaped like a pyramid. So this part is what is the apex of the pyramid. Now this is what is the anterior slant. We can see here the anterior slant is known anterior because it faces anteriorly, it faces the middle cranial fossa. And this is what is known as the posterior slant because it faces posteriorly, it faces the posterior cranial fossa. And where is the third part of the pyramid? Yes, the third is, these are the two, the third is in the base that we are not seeing in this section. So the whole of the inner ear is present inside the petrous part of temporal bone. It is something like this. Yes, can you see this? This is the whole of the inner ear and it is present inside this petrous part of temporal bone. Here it is appearing to be outside just to show you, but it is housed inside the petrous part of temporal bone, and through this connection, this opening, the internal acoustic meatus, it is connecting the inner ear to the brain. So can you tell me the internal acoustic meatus connects the inner ear to which cranial fossa? Anterior, middle or posterior cranial fossa? Yes, very good. The posterior cranial fossa. So yes, here this opening that we are seeing on the posterior slant of petrous part of temporal bone is what is known as the internal acoustic meatus. Now I told you that the whole of the inner ear is present in the petrous part of temporal bone. In fact, not only the whole of the inner ear, the whole of the middle ear is also present in the petrous part of temporal bone. And yes, listen to this carefully. The whole of the ear is present in the temporal bone. It is present like a tunnel in the temporal bone. Let us see how. Yes, so for that, first we need to understand what the parts of the temporal bone are. So in this section, what we are seeing is the two parts of temporal bone. This is what is the petrous part. I just showed you the parts of the petrous part. Yes, this part of the temporal bone, this is what is known as the squamous part of the temporal bone. Now, when we see in this section, we are able to see only these two parts, the petrous and the squamous part. See this view. Now, in this view, what we are seeing is the squamous part here. And to see the inner part of the squamous part, this is the inner part of the squamous part. We already saw that. So, this is the outer part of the squamous part, how it looks. And this is what is known as the mastoid. So, this is squamous. This is the mastoid. The mastoid, as you can see, is superficially formed by the extension of the squamous part. The squamous part forms the outer part of the mastoid, and the inner part is formed by the petrous part of the temporal bone. Now here, this bone, can you see this bone? Yes, this is a crest of curved bone, a curved bone which hangs down from the squamous part, and this is what is known as a tympanic bone. Tympanic bone. Yes, I will show it to you in a better picture. Yes, now see this. Yes, can you see this is the squamous part? This is the mastoid part. And here, this bone, can you see this, the dark green? This is what is the tympanic bone. It hangs down from the squamous part, and posteriorly it meets the mastoid part. So it is as if the squamous and the mastoid part are forming one C, and the other part of this C is this curved is the tympanic bone, which is forming the complete canal. It is something like this. This is the squamous and this is the mastoid part forming one part. And this is the other part is completed by this curved bone, crest of bone. This is what is known as the tympanic bone to cover the whole of the external auditory canal, to form a canal-like structure, which we call as the external auditory canal. As you can see here in this picture, this here is the tympanic bone. This is the squamous part superiorly, right? Okay, so what are the parts of the temporal bone that we have done? We saw the petrous part. This is the squamous part. This is the mastoid. This is the tympanic part. And here we have a projection of bone. This is known as the styloid. This is known as the styloid process. Now listen to this very, very carefully. The whole of the ear is present like a tunnel in the temporal bone. Yes, now see this. To understand this, just see this. Yes, here this is the temporal bone. Let me just remove it. Yes, I've removed it, and this is what you're seeing. This is the petrous part. This is the squamous part. Here we have the mastoid part. This is hanging down like a crest, like a curved crest of bone. That is the tympanic part. The whole of the ear is present like a tunnel inside this temporal bone. Did you get it? Yes, the external auditory canal, the external ear, that is present like a tunnel in this part. Yes, whereas the whole of the middle ear and the inner ear is present like a tunnel in the petrous part of the temporal bone. Is that clear? The whole of the ear is housed inside this temporal bone like a tunnel in the temporal bone. So this is how the temporal bone on both the sides is. And can you see the tunnel inside it? Yes, the ear, it is present like a tunnel inside this temporal bone on both the sides. The outer opening is this, the external acoustic meatus, and this is the inner opening of this tunnel, the internal acoustic meatus. And this tunnel inside the temporal bone is what we call as ear, which is divided into three parts. Having seen that, can you now understand at such a strategic location the ear is? Which means that if there is any infection of the ear which comes up, which goes superiorly, where is it going into? Yes, it is entering the cranium. It is going inside the cranium. It is becoming intracranial pathology. Yes, so we exactly need to know what the relations of the ear are inside. And if you understand this, believe me, so many questions of so many diseases, you will be able to answer, not only answer, you will be able to understand it very well. So yes, where we have the ear is, it is present like a tunnel in the temporal bone. So here we have the pinna, we have the external auditory canal here inside, we have the middle ear, and then we have the inner ear, and this is the connection between the inner ear and the cranium. Till here we already know. Okay, now just see carefully. This part, which is the roof of the external ear, roof of the middle ear, roof of the inner ear. Are we getting that? Yes. So if I ask you that roof of external ear, roof of middle ear, roof of inner ear is formed by what? Yes, it is formed by the petrous part of temporal bone. Which part? Yes, the anterior slant. It is formed by the anterior slant. And this here, the roof of the middle ear, is what is known as tegument tympani. It is known as tegument tympani. So if any infection from the middle ear goes through the tegument tympani, where does it reach? Yes, it goes intracranially. It grows intracranially. It will lead to involvement of which cranial fossa? It will lead to which abscess? Which lobe do we have here? Yes, we have a temporal lobe here. So can a middle ear infection lead to a temporal lobe abscess? Yes. How? Going up through the tegument tympani. Now this here is the roof of the inner ear. In this roof is a bulge that is produced by the superior semicircular canal. Yes, we know we have 3 semicircular canals, and how are they named? Superior, posterior and lateral. Why are they named so? According to which direction they are going into. So superior as the name, it goes superiorly. What is superiorly? The base of skull. So the superior semicircular canal bulges superiorly in the base of skull, and where it bulges is in the anterior slant of the petrous part of temporal bone, and this is seen clearly like a bulge, and this is what is known as the arcuate eminence. Arcuate eminence. And this arcuate eminence, this area of arcuate eminence can be dehiscent, which means it can be gaping, it can be very thin, or it can be gaping. What's the significance? Yes, if it is gaping, that is what we call as superior semicircular canal dehiscence syndrome. That is known as third window syndrome. All that we'll see in detail later on. But what we are seeing here is that this area of the arcuate eminence can be dehiscent. And if it is dehiscent, what will happen? Any increase in intracranial pressure directly through that opening, it will get transmitted to the inner ear. The inner ear will get stimulated, and patient will come to us with the complaints of inner ear symptoms. So, is there any disease in the inner ear? Is there any pathology in the inner ear here? No, the pathology is not in the inner ear. Where is the pathology? In the base of skull. So we have to be aware that there is something like this which can, without any problem in the inner ear, make the patient come to us with the complaints of inner ear pathology. Now just see this medial to it. Just medial to the arcuate eminence. Can you see a depression here? Can you see this depression? Yes, this is what is known as the Meckel's cave. Meckel's cave. Can you tell me what the Meckel's cave is? Why this has become like a cave? Why is a depression produced here? Yes, because some ganglion is present here, the pressure of which produces this cave. Which ganglion? Very good, the fifth nerve ganglion. Quickly tell me the name. Yes, that is the Gasserian ganglion. Gasserian ganglion. So here we have the fifth nerve ganglion, and yes, the fifth nerve ganglion is present here, and from here it gives the 3 branches. Yes, what are the 3 branches of trigeminal? Yes, the ophthalmic, which goes through the supraorbital fissure into the eye, the maxillary, which goes through the foramen rotundum, yes, down to supply the face, and then we have the mandibular, which goes out through the foramen ovale. And I hope you are telling this before I am telling this. Yes, so now tell me, can any infection of the ear involve the trigeminal nerve? You will think here we have 8th nerve. So that will involve the hearing, or that will involve the balance. Yes. Do we also have involvement of the 5th nerve in ear conditions? It can happen only if the infection has reached where? It has reached up till the apex of the petrous bone. It has reached up till the petrous apex, where we have this Meckel's cave. So how will be the presentation of the patient if the trigeminal nerve is involved? Tell me, what will be the presentation? Yes, it is not asked in your question that trigeminal nerve is involved. The presentation is given. Yes, trigeminal nerve we know is for the sensation of the face, so paresthesias of face, or it is the ophthalmic, gives sensation to the eye. So how do we test the sensation of the eye? By the corneal reflex. So the corneal reflex is absent in this patient. In your condition, that gives you a hint where has the infection reached, or where is this condition involving? Yes, it has gone to the Meckel's cave area, the apex of the petrous bone. Now just see a little more medially. Now this part, which is exactly at the apex, from here passes the sixth cranial nerve. Yes, sixth cranial nerve, from where does it come? We have the midbrain, we have the pons, we have the medulla, like this, yes. So from the pons arises the fifth nerve that goes to the Meckel's cave area like this, and then how it goes further we know that. Now from the junction of the pons and the medulla comes out the sixth nerve, and this sixth nerve, after coming out, it passes through the petrous apex and then it goes anteriorly. What does the sixth nerve supply? Yes, sixth nerve. Yes, it is the LR6, lateral rectus 6. So it goes out through the supraorbital fissure and then it supplies the eye. Now anything that has to go from the brain into the eye or from the eye into the brain only through two openings. One is the supraorbital fissure here and the other is the optic canal. Yes, so this is also going out through the supraorbital fissure. So what we are seeing is that sixth cranial nerve is got a very long course, intracranial course. It is arising quite posteriorly at the level of the posterior cranial fossa, whereas it is exiting the brain through one of the most anterior openings, the supraorbital fissure. So what we need to know here is, so here this is the fourth thing and this is at the petrous apex, that is the sixth cranial nerve, sixth cranial nerve. Yes, so what we are seeing here is that if there is any pathology which involves the petrous apex area, can you tell me which cranial nerves will it involve? Petrous apex area, which cranial nerves will it involve? Yes, the fifth and the sixth cranial nerve. Very good. Yes. So now I am telling you that there is an infection of the ear which has reached up to the petrous apex, and that is now what we call as petrositis. So which cranial nerves will be involved in a patient of petrositis? Fifth and sixth, which means here is a patient of ear infection who has come to you with paresthesias of the face and he has come to you with diplopia. Yes, what is diplopia? Double vision. Whenever one muscle is not working, so the eyes will not move appropriately. That will lead to doubling of vision, diplopia. So yes, the patient is present with fifth nerve and with sixth nerve. Tell me where the lesion is. Petrositis. Yes. So when you understand this, that is the most important question that is asked in petrositis. You don't have to rectify it. You immediately know this has to be petrositis. Yes. So now we know everything that was present on the anterior slant. Now coming posteriorly. Yes, when we come posteriorly, on the posterior slant, we know this opening. You will tell me what this is. Yes, this is the internal acoustic meatus. Now you will only tell me any structure, any nerve, any vessel which is passing through the internal acoustic meatus from the brain is going where? Yes, it is going into the ear. Tell me exactly which part of the ear. Yes, the inner ear. So what will be these nerves? Yes, these will be the nerves that are for hearing and balance. Yes, the eighth cranial nerve, the vestibulocochlear nerve. And along with that, there is another nerve that passes from the brain into the ear through the internal acoustic meatus. That is the seventh cranial nerve, the facial. The name tells you that it supplies the muscles of the face. Yes, but from the brain, it directly does not go to the face. It first goes into the ear, gives a few branches in the ear, and then it comes out through the stylomastoid foramen just below the styloid, and then comes to supply the muscles of the face. So here, this is on the posterior slant. This is the fifth structure that we are seeing here, and this is the internal acoustic meatus through which are passing the seventh and the eighth cranial nerve. Wonderful. Okay, now can you tell me what is this opening here? This? Can you see this opening? At the junction of the petrous bone and the occipital bone, what is this opening? Yes, this is the jugular foramen. Can you tell me the nerves that pass through the jugular foramen? Yes, the 9th, 10th, 11th cranial nerves, all the foramen in the base of skull. Very, very important, very commonly asked. Now, the ones in relation to the ear, very commonly asked in the ear. So, what are the structures that pass through the jugular foramen? Yes, the 9th, 10th, 11th cranial nerve. And that is a sequence that is going from above downwards. Yes or no? Here we have the 5th from the pons, then we have the 6th, then we have the 7th and 8th. And then here we have the 9th, 10th and 11th going out. So what we are seeing is that when the 9th, 10th and 11th are going out through the jugular foramen, yes, the moment they go out, they are in relation to some part of the ear. When they are going out, below is this area houses the middle ear. So they are lying immediately in the floor of the middle ear. We'll see that again in some time in great detail. So for now, what we are seeing is that this area has the 9th, 10th and the 11th cranial nerve. Yes. So this is the 6th structure that we are seeing here. This is the jugular foramen, and that has the 9th, 10th, 11th cranial nerve. Now let me ask you one question. There is a tumor arising from the internal acoustic meatus. And now that tumor has gone intracranially. So the moment I'm saying this, I hope the complete picture is coming to your mind. Whether it is ear, nose or throat, it is not something which you can easily cut open and visualize. So you have to form a picture in your mind. And whenever you're reading the question, whenever you are reading anything, immediately the picture should be crystal clear, and no matter what is asked, you will be able to answer. Yes, so what is my question is, there is a tumor arising in the internal acoustic meatus and now it has gone intracranially. Yes, so you are going to answer 3 questions for me. First, in the internal acoustic meatus, it is going to involve which cranial nerves? In the meatus. Very good, the 7th and the 8th cranial nerve. Okay, now when it goes intracranially, the upper pole of the tumor is going to involve which cranial nerves? Yes, so here it has gone intracranially. Here the upper pole will involve which cranial nerves? Very good, the 5th and the 6th cranial nerve. The lower pole of the tumor will involve which cranial nerves? Excellent, the 9th, 10th and 11th cranial nerves. And do we know which tumor is this that we're talking about? Yes, this is the acoustic neuroma. And if you know this about acoustic neuroma, you know almost everything how the patient of acoustic neuroma might present. This is the sinus. Which sinus? So here we have the straight sinus. This is the straight. This here is the transverse sinus on both the sides, which is known as the lateral sinus. And here this is the S-shaped sinus, which is known as the sigmoid sinus. So this is the 7th structure that we are seeing here, and that is the sigmoid sinus. Yes, so can the sigmoid sinus be involved in diseases of the ear? Yes. So where exactly is the ear? Where is the sigmoid sinus in relation to the ear? We saw that we have the pinna here. We have the external auditory canal. We have the middle ear. Now behind the pinna and behind the external auditory canal, what do we have? This area is the area of the mastoid. This is the mastoid area. So where is the sigmoid sinus? Yes, sigmoid sinus forms the posterior boundary of the mastoid. Show me your mastoid. Your mastoid. Yes, this here is the mastoid. So where is your sigmoid sinus? Yes, it forms the posterior boundary of the mastoid. So next time, whenever we are going to say sigmoid sinus, your finger should immediately go here. This is the area of the sigmoid sinus. So we can see that this is in such an important relation to the ear. Many of the times there is disease of the mastoid. We have to remove the disease of the mastoid. So there we have to be very careful not to injure the sigmoid sinus. Where is it in relation to the sigmoid? Where is it in relation to the mastoid? Yes, the posterior boundary of the mastoid is the sigmoid sinus. Now the sigmoid sinus depression, we are seeing it is ending at the jugular foramen. So does the sigmoid sinus end at the jugular foramen? Yes, it exits through the jugular foramen, where it is known as the jugular bulb. And then it comes down in the neck, forming the internal jugular vein. So can a sigmoid sinus thrombosis lead to a jugular vein thrombosis? Yes, it is the same. It is the extension, and that is why this, because of the jugular bulb occupying the jugular foramen, it is known as jugular, the jugular foramen. Yes, otherwise what exists through the jugular foramen? We have the 3 nerves, 9th, 10th, 11th. But along with that also passes the jugular bulb. And as I told you, when it is the moment it is coming out, it is lying in relation to the floor of this area. This area is the middle ear, floor of the middle ear area. Again, I am telling you, we'll see that in some time. Okay. So before we proceed, yes, just keep your pens down. Sit straight. Yes, very good. Okay, so now you are going to tell me quickly. The complete inner ear is present in which bone? Inner ear is completely present in which bone? Yes, the petrous part of temporal bone. The inner ear houses the sensory end organ of hearing and balance. And it is very, very important for our survival. Without balance, we would not be able to live one moment happily. So yes, that is protected by the rock-like bone. Petrous means rock. Yes, so it is a very hard bone. So yes, it is present in the petrous part of temporal bone. Yes, can you tell me that what are the parts of the temporal bone? Quickly tell me the parts of temporal bone. Yes, we have the petrous part. Very good. The squamous part. Tympanic, mastoid, and the styloid part. Yes, roof of the middle ear separates the middle ear from which cranial fossa? Any infection from the middle ear, if it goes through the roof, it enters which cranial fossa? Middle cranial fossa or posterior cranial fossa? Yes, the middle cranial fossa. Whereas the internal acoustic meatus connects the inner ear to which cranial fossa? The posterior cranial fossa. Where is the internal acoustic meatus present? Which bone? Petrous bone. Which slant? Anterior or posterior slant? Yes, the posterior slant. Okay, where is the bulge of the superior semicircular canal? Anterior slant, posterior slant? Anterior slant. What is the bulge of the superior semicircular canal known as? Arcuate eminence. If it's a dehiscence there in the arcuate eminence, what is that known as? Superior semicircular canal dehiscence. In any patient of petrositis, which cranial nerves will be involved? Yes, the fifth and the sixth cranial nerve. Very good, the fifth and sixth cranial nerve. Any tumor that arises in the internal acoustic meatus, in the meatus, it will involve which cranial nerves? Seventh and eighth. When it comes intracranially, the upper pole of the tumor will involve fifth, sixth. Lower pole of the tumor will involve ninth, 10th, 11th. The 9th and 11th cranial nerve exit the cranium through which foramen? Jugular foramen, along with jugular bulb. Jugular bulb is the continuation of sigmoid sinus. Where is the sigmoid sinus in relation to the ear? Posterior boundary of. Immediately your finger should go where? There. Yes, where? Yes, the posterior boundary of the mastoid. Posterior boundary of mastoid. So now we have seen that the tunnel of this ear, superiorly, what are the important structures? If infection goes superiorly, where all it can go and what all it can involve. Now just tell me, if the infection of the ear goes inferiorly, where will it go? It is present in the tunnel of the temporal bone. If it goes inferiorly, what is inferior? Yes, I am telling you that if the infection from the ear goes inferiorly, it goes to the base of skull. Tell me, I am right or wrong? It goes to the base of skull. Yes, that is true. That is true. Here we have the ear in this temporal bone. Superiorly is the base of skull and inferiorly again is the base of skull. Let us see how. So this is the temporal bone. Yes, this is the inferior part of the petrous part of the temporal bone. Is it again a part of the base of skull? Yes. So what we are seeing is, if it goes superiorly, it goes into this part of the base of skull, that is cranium, intracranially. Where it goes inferiorly, it goes into this part of the base of skull. Is that very clear? Yes. So let us have a closer look at this part of the base of skull to see. Yes. So here this is the temporal bone. This is the petrous part. Yes, all this is the temporal bone. Yes, so now just see this area. Can you see this opening here at the junction of the petrous bone and the occipital bone? Can you tell me what opening this is? Yes, this is the jugular foramen. That is what I told you. Yes, the jugular foramen at the junction of the petrous bone and the occipital bone. What exists to the jugular foramen? Yes, the 9th, 10th, 11th cranial nerve along with the jugular bulb. So I told you that when they come out, they are lying in the floor of the middle ear. So this area is the middle ear. This area is inside. We have the middle ear. So this is the floor of the middle ear. So which means that any infection from the floor of the middle ear comes down. It can involve which cranial nerves? Yes, the 9th, 10th, 11th cranial nerves. And in other words, if there is a tumor of the jugular bulb, it will project into which part of the ear? Yes, the middle ear. Now you are going to tell me one thing. One foramen, I told you. Now you tell me this foramen. This is the jugular foramen area. Yes. Which is this foramen? Anterior. This is the anterior part. This is the anterior part. This is the posterior part. Yes. This foramen here, anterior to the jugular foramen. Yes. This is the carotid canal. This is the carotid canal. And behind that, this is the jugular foramen, carotid canal. So can you see that the carotid is also in very close relation to the ear? Yes, it is. And yes, just see here, this is present anterior, quite anterior to the jugular foramen. So it is in relation a little anteriorly to the ear. Yes, again, very closely to the ear. In fact, the parts of the carotid, when we remember what are the parts of the carotid? Yes, we have the cervical part. And what's the next part? The petrous part. Petrous part of the carotid. So let us see what it is. Yes, from the cervical area, this is the cervical part of the carotid. Now it enters when it enters the petrous part of the temporal bone, it runs vertically. Yes, this is known as the vertical segment of the carotid. Yes, of the carotid. And then it takes a turn. This is known as the genu of the carotid, and then it runs horizontally. Yes, so this is the genu. And this is the horizontal segment of the carotid. Okay, now let us see in this. Yes. So from below will be this is the jugular foramen here. So a little anteriorly to that will be the carotid canal. Okay, I'm drawing it here like opening. It is not the opening. I'm drawing the base of skull area there. Yes. So we have the carotid. So it enters here. Vertical part we have, and then it takes a turn. It takes a turn, that is the genu, and then it runs horizontally like this. It runs horizontally, and does it come out here at the exit of the carotid canal, overlying it passes through the foramen lacerum. It comes out here superiorly, passing through the foramen lacerum, and then it passes through the cavernous sinus. We have heard that, yes or no? Yes. So can the carotid be injured in ear surgeries? Can the carotid be involved in conditions of the ear? Yes, it lies very much in relation to the anterior part of the ear, anterior part of the middle ear. This is the anterior, right? This is the posterior. So the anterior part of the middle ear, it passes through the petrous bone. So in fact, in aneurysms of the carotid, mainly patients have complaints of ear. So yes, that is a very, very important thing that we need to know. Just see here, this is the vertical segment of the petrous part of carotid. This is the genu, and here is the horizontal segment where it comes out here, passes through the foramen lacerum, and then into the cavernous sinus. So having a closer look at the base of the skull, which forms the floor of this tunnel, this tunnel which we call as the ear, as we can see here, this is the tunnel, this is the external auditory canal part, formed by posteriorly the mastoid, superiorly the squamous, and here we have the tympanic bone extending this complete curved bone here. So this here is the base of skull area. Yes, so now can you tell me that if any infection goes out of the external auditory canal, in other words, any otitis externa, infection of the external auditory canal, otitis externa, can it lead to skull base osteomyelitis? Can it go to the base of skull? Yes or no? Yes, it can. It is so easy. Just out of the ear inferiorly. Where is it? Into the base of skull. Yes, so one of the otitis externa is what is known as skull base osteomyelitis, and that is a very, very important question of your exam. And then don't think that, okay, from the ear it has gone to the base of skull. Yes. No, it is not difficult. It just has to go out inferiorly from the ear. It is into the base of skull. Now, let me ask you one question. If it goes out from the external auditory canal into the base of skull, here, which foramen do we have? Yes, here is the styloid process. Here is the mastoid. Just below, in between that is the stylomastoid foramen. We have the stylomastoid foramen. Which nerve? Tell me. Yes, the seventh cranial nerve. Seventh cranial nerve. So if any infection of the external auditory canal, otitis externa, goes outside, which is the earliest cranial nerve will it involve? Which cranial nerve will be involved the earliest? Seventh cranial nerve. Just below here, we have the seventh cranial nerve. So can you see that if you know all this, you don't have to ratify, and these are the questions that are asked in your exam. In fact, a patient comes, you are seeing that there is a lot of infection of the external auditory canal, and this patient has a facial palsy also, and this only from the external auditory canal, rest of the ear is looking good. It is only the external auditory canal. So then you know that it has gone where? It has gone out from the floor into the stylomastoid foramen involving the facial nerve. Now, if it goes out from the floor of the middle ear, which cranial nerves will it involve? 9th, 10th, 11th cranial nerve. So here deep down, here we have the jugular foramen area, the floor of the middle ear area. So now quickly tell me, if any infection goes from the ear superiorly, can it involve the 9th and 11th cranial nerves intracranially? Yes or no? Yes, at the jugular foramen. Intracranially also it can involve. If it goes out from the floor into the base of skull, can it involve the 9th and 11th cranial nerves? Yes, it can involve. From the jugular foramen, when it is going out, that area is exactly the floor of the middle ear. Yes, can the infection of the ear involve the 6th and the 5th cranial nerve? Yes or no? Yes, it means where is the infection reached now? Yes, to the petrous apex. It is now a petrositis. So we know when the infection goes superiorly, where it has gone, where it goes inferiorly, where it has gone. And when we have a look at this picture, now we are able to make out what we are seeing. We are seeing a tunnel in the temporal bone. And this tunnel houses the structures for hearing and balance, and this tunnel is what is called the ear. What lies superiorly in relation to it, what lies inferiorly in relation to it, we know all that structures. So from now on, whenever we hear the temporal bone, whenever we see the temporal bone, we know exactly crystal clear what is inside the tunnel, what is outside the tunnel superiorly, what is outside the tunnel inferiorly. Now suppose I want to see these structures radiologically. Which investigation should I go for? So which is the best radiological investigations for ear conditions? Yes, we know it is housed in a bone, so it will be CT or MRI. Yes, it will be a CT, and we know that these structures are so minute, so it has to be a high resolution CT. So always the best CT for ear has to be a high resolution CT. This is the best CT for the ear. Whenever for ear conditions you want to get a radiological investigation done, what will you write to the patient? Will you write CT of the ear? Never. What you write? HRCT of temporal bone. So whenever we say temporal bone, what do we understand? What exactly is a temporal bone? Why is it significant? Because it has the ear. So whenever we have to write a CT of the ear, what do we write? We write HRCT temporal bone. Is that clear? So now here is HRCT temporal bone in front of you. And earlier you would have been baffled when you see this and not understood anything. But now when you see it, just focus. What are you able to see here? So now you know if you have to see the ear, which area you have to focus on. Yes, this is the area of the temporal bone where you have to focus. You can see the ear like a tunnel. This area is the pinna. Some part you are able to see of the pinna here like this. This is the tunnel inside. This is the external ear. This is the middle ear. This is the inner ear here. Yes, this is the petrous apex. Here anteriorly we will have the fifth nerve, the sixth nerve. Here posteriorly from the inner ear is the connection. This connection, internal acoustic meatus. Behind the pinna and behind the external auditory canal, this is the area of the mastoid cells. Yes, is that clear? If I tell you that this patient has a sigmoid sinus thrombosis, where will you look for the sigmoid sinus in this patient? Tell me. Yes, this area. This area will be the sigmoid sinus. This area will be the lateral sinus. Yes, this is the internal acoustic meatus. This is the petrous apex area. Yes, is that clear? So, this is what we need to know in the basics of the ear. And if you have understood this, believe me, the disease of ear is going to become very, very simple for you. And now when you see this, you know everything, what is present inside it, what is present outside superiorly, what is present outside inferiorly.